Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. After 30 years in medicine, this physician somehow stays more curious, more energized, and more committed than ever. Dr. Doug Adler. Dr. Adler describes the way he has seen the field evolve. We talk about the shift towards gap years, the rising pressure on students, and the quiet maturity that separates applicants who are ready from those who still see this as an extension of college. He describes the day he realized what it actually means to be responsible for another human life, and how research became the place where he expands his reach far beyond the walls of his own clinic, shaping the care of thousands of patients he'll never meet. And his hobby is incredibly cool: flying planes, writing about space exploration, and interviewing the very people he dreamed of becoming as a kid. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Dr. Doug Adler. Dr. Adler, thank you so much for joining us today on Shadow Me Next and taking the time to share your incredible story, including a hobby that I think is one of the coolest things I've ever heard.
Thanks for having me. I really appreciate it.
So, Dr. Adler, you have been working in medicine for 30 years, over 30 years?
30 years this year. Yikes.
You've seen a lot. 30 years is a long time in medicine, especially with the number of changes that I'm sure you've seen. And I usually like to start the episodes talking about your path to your career and your journey into medicine, but maybe we can do things a little differently because you also have mentored a lot of students through this journey. So, Dr. Adler, tell me how it looks different. Tell me how that's changed, that journey into medicine from when you did it until now, what you're seeing with your students.
Sure. So I do think that stuff has changed quite a lot. And it's, at 30 years, you can kind of see things or bigger trends that were invisible to you earlier on. When I was an undergrad, and I was never somebody who wanted to go to medical school. Like, I was never the kid who said they wanted to go to medical school. I was never that person. I really went to college unsure of what I was going to do. And then I really didn't decide to apply to medical school till I was a junior. And I had looked at other classes and other fields of study. Like, I very seriously thought about getting a PhD in astronomy or physics.
Whoa.
And then I ended up taking a biology class. I think it was the last semester of my sophomore year. And I really, really enjoyed that. And I thought, maybe I should go to medical school. And then I did a summer in a laboratory. I worked at Cold Spring Harbor. And that made me realize two things. One is that I really like biology, and two, I did not want to be a PhD in biology at all. And then I came back to college in the fall of my junior year and realized that, hey, I should go to medical school. But then I had 2 years to basically do all of the prerequisites. So I sort of was taking 4 and 5 science classes a semester.
Whoa.
To get everything done and graduate in 4 years. So like my sort of time of thinking about doing this, taking the pre-med classes, taking the MCAT, and applying to medical school was very, very compressed. But in my first 2 years, I really kind of wasn't, I was taking math and physics and chemistry and, English and anthropology, and I just really wasn't focused on medical school till late. But when I went and I graduated college in 91, um, everybody went straight to med school. Like if you didn't go
Mm-hmm.
straight to med school, there was something wrong with you. You were a loser. Like you had like a deficit that you had to make up for. And I didn't know anyone. I mean, everybody I knew was pre-med by the end, and everybody went straight in. And I think one of the biggest changes now is that people are almost expected to have a couple of gap years, additional
Mm-hmm.
experiences, publications, research, and that really was not required for us. We were expected to, have good grades in our core pre-med classes and a strong MCAT score and good letters. And that was kind of what they expected of us. And virtually nobody had research experience. And, I had worked in laboratories. By the time I graduated college, I had a couple of years of laboratory experience under my belt, and that was very uncommon. So, I was a 21-year-old first year medical student, and I was a 25-year-old intern.
Wow.
And now, the med students that I am working with, and we get med students from two medical schools at my hospital, they're 27, 28, 29, and they're third year med students, and when I was 29, I was a GI fellow.
Wow.
So I think that is a big change. On the one hand, it's good in that they are more mature. They're certainly more mature than, most people. I mean, you can't compare a 29-year-old to a 25-year-old. It's just a different phase of life. But on the other hand, a lot of them are starting families when they're still in medical school and they're accruing debt. And they are going to de facto, be shaving a couple of years off of their career financially. So it does give and it does take. But like when I was a medical student, my first year, the average age in my class, I think, was 21. Like we were
That's
all straight
insane.
out. There were one or two people who weren't straight out, and they were viewed as highly atypical.
Yeah, the demographics, I would imagine, have just vastly changed. And you mentioned something that I would like to touch on quickly, and that's research. And I think that's a main differentiator between, do you want to go to medical school? Do you want to go to PA school? For a lot of the students that I'm talking about is, well, do you have any research experience? And as you said, when you were going through this, research really wasn't a huge, it's
No,
not something you saw on every resume. And I think now for medical schools it is. But now you've published over what, 500 scientific papers and
700.
oh, 700.
Right. Yeah.
Oh, and you've written
But
textbooks and so do you think that that research background is really, really needed for physicians these days?
well, I mean, not for everybody. I mean, you have to really care about it, and I've said this many times that it's literally what gets me up in the morning. Like people who know me know that like I am very, very focused on the research. Like I'm in full-time clinical practice. But I get up at 4 in the morning and before I go to work, like I usually leave for work around 6:30, but before I go to work, I work on a couple of projects for a few hours in the morning every day because I like it and I care, and it's a way for me to affect the care of thousands of patients that I'll never meet. Like you write an article, somebody reads that, it affects the way they care for patients. Like I've never met those patients, but I can have an input in their care. Um, and like at this point in my life, like I don't need to do research anymore. Like I've been a tenured professor, I'm a professor now. Like, I don't really need to publish anymore, but I really enjoy it. It's good to work with other people. It's good to sort of push the envelope or see how other people treat diseases or do procedures. So I really, really enjoy it. Like it is very motivating. And I see, yeah, I don't want to be negative, but I see a lot of my colleagues are bored. And
Mm-hmm.
and they've been doing the same thing for 20, 30 years. They're master clinicians, like nothing surprises them. And like sometimes I'll say to my friends, any good cases? And they'll be like, no, not really. Like they're bored. And the research keeps you from getting bored because it's always new, it's always different. There's always something new to write. There's always a new study to do. There's a new device to evaluate or a new drug or something to do. And it's a way to stay engaged. And I think it also keeps your brain a little sharper. I hope it's keeping my brain sharper.
Absolutely. That is, of course, Dr. Adler, a perfect transition into my next question as well. We sell medicine as being a place for lifelong learners. right? And so much of your resume is about education. But it sounds like this research is kind of where that lifelong learning kind of comes to fruition. Is it just that, or do you see that in clinic as well? Are you still learning in clinic in the
Oh,
OR?
oh, you're definitely still learning. I think you have to. I was just this morning thinking about this, and I'm going to post on X about this later today. And I think that a lot of people do get stale, and they sort of petrify at the end of their training, and they just basically practice the way that they learn in their training. And that'll get you by for about 4 or 5 years. And then things really start to drift. And then drugs change and devices change and procedures change and new procedures come and old procedures are, obsolete. And, like I make an effort, like I'm an interventionalist, I'm in procedures every day. And I make an effort to learn a couple of new procedures every single year. Like when I learn them, am I sure I'm going to use them or need them? Like, I don't know. Like, you don't know what's going to take off or what's going to get traction, but it's always good to sort of have your hand in new things so that you don't get stale. You don't become a dinosaur. And I've practiced with more than a few doctors who were just literally ossified, and they were using drugs that had been obsolete for 20 years or doing their procedures in a way that really, really dated them. And unfortunately, most patients aren't sophisticated enough to pick up on that. Like, oh, she's practicing like it's 1998, right? And they just think, oh, the doctor told me to do this. But other doctors know, and you don't want to be that dinosaur.
It's a nice teaser for talking about your podcast, which we'll talk about later, that I know a lot of clinicians listen to, but a lot of patients listen to as well. It's great to be informed. It's great to know, oh, I'm going to see my GI doc for this procedure. Let me see how they're practicing it now, and let me see what my physician is going to recommend. I don't know if I want a procedure that was, popular in 1995. Maybe I do. Maybe I do. But there's been so much advancement, and it is so exciting for us as clinicians to practice those advances. But it should also be equally exciting for the patient to benefit from those advances as well. So we're going to dive into that. Now, you mentioned something that I am just so excited to talk about, and it is the fact that you are an interventionalist. You do procedures every day. So you are a gastroenterologist. For our listeners, describe what that means. And then what does your day look like? I'm thrilled to hear this.
So GI is kind of misunderstood. Like nobody on earth goes to medical school to be a GI. Nobody at all, ever. Because, they have perceptions of what a GI does based on jokes they heard in junior high school. A guy goes to a proctologist's office, or like, oh, that would smell bad, or that's disgusting. And then when people go to med school and they start hanging around the hospital for a couple of years, they suddenly realize, like, oh, wow, that's a really good specialty. Because we get young and old patients. Not all specialties get young and old patients. We get benign and malignant disease. And this is going to sound silly, but we get a lot of organs. Like, some specialties get one organ. Like that's it. That's all they get. Like some specialties practically get one chief complaint. But we get esophagus, the stomach, the small bowel, the large bowel, the pancreas, the bile ducts, the liver. Like we get all these organs and they can have all sorts of dysfunctions. And GI in 2025 is very much a procedural specialty. When people think of a colonoscopy, like that's kind of people's perception. But colonoscopy is just one of many, many things that we do. There's all manner of upper and lower endoscopy, complex interventions in the bile ducts, in the pancreas, in the liver, in the gallbladder. There's what are called third space procedures that we do all the time now, where we violate tissue planes and enter into other areas of the body that would otherwise not be accessible. And some of those areas have nothing to do with the GI tract, and we just use our endoscopes. And there's a huge variety of devices to do things that many, many years ago were surgery. And now, you would never consider doing surgery. My wife and I are rewatching ER. On ER, like the patient is seen in the emergency room, and then they call surgery, and the patient is always run off to surgery, and they show them doing these giant surgeries with their hands in the patient's abdomen and chest. And like every day I say to my wife, like, that none of this would happen anymore. Like this is all like minimally invasive. like we would do this with a scope and the patient would eat dinner at home that day and wouldn't even stay in the hospital. And like it is interesting to, at least within the context of that particular media program, to see how much stuff has changed. And again, when I was a med student, everybody got run off to the OR and they were in the hospital 10 days, off of work 6 weeks. And it's just not like that anymore. And GI has really been at the forefront of that. So, like, again, nobody goes to med school to do GI, but GI is now the most in demand subspecialty, like, bar none. Like, it's easier to become a plastic surgeon than it is to become a gastroenterologist. And when I was at the University of Utah, I was a fellowship director there for 7 years. We had 2 or 3 spots a year. I mean, we never got less than 400 applications.
Oh my
Never.
goodness.
Right, but that's what I mean. So like there's the perception that you have going into med school, which is based on nothing essentially. And then there's the reality of that you acquire from hanging around the hospital for a couple of years, and then people think very, very differently about stuff. But I do think, I know you have a lot of pre-medical applicants listening to the pod. It's really hard to escape these media influences, whether it's House or Scrubs or Grey's Anatomy. I was heavily influenced by Dr. McCoy and Hawkeye Pierce, right? These were the media doctors of my youth. And it has nothing to do with reality, like zero. It has zero bearing on reality. So I think that, if you're going to med school, you have to go in just open and just sort of see like what is concordant with your personality, what is concordant with, how much do you want to work? What do you want to do? Do you like to do procedures? Do you want to be in clinic? Do you want to be reading x-rays? And you don't really know that about yourself until you get out there. And that I think a lot of people have that difficult sort of needle scratching on the record moment where they say like, oh, the thing I've been saying since third grade, I'm really not interested in. And this other thing that I had never even considered is a better fit for me. And like, for example, one of my best friends in medical school, she became a pathologist. And that was not something I got the sense she had ever considered before going to medical school. And then, a pathologist is a highly atypical physician job, doesn't see patients ever, right? Not what I'm saying? Like with a microscope all day looking at slides. And she's really engaged in her job and glad she does what she does. But, like she didn't go to medical school saying, I want to look at glass slides for 40 years, right? Like you just have to kind of be willing to go where it leads you.
It's really great advice. And it's one of the reasons why I created this podcast, Shadow Me Next. It's becoming more and more difficult to get that exposure and that experience that you're talking about. But if we can just get a sneak peek into some of the lives of these clinicians and say, okay, that guy's a GI doc. Why does he like working in GI? I had a urology NP on just before this, and somebody might say, why in God's name would she want to look at that body part all day? And she's so passionate about it. And until you really understand and talk to these people why, it might not make sense to you. And you mentioned a couple of things that I think are so great. You can't just focus on what medicine you want to do. You have to focus on what that looks like, what you're like. Or do you want to be more clinical? Do you want to be more procedural?
Right.
Like you mentioned, how hard do you want to work? And it's even more than that. It's how passionate are you about working that hard too, And these are questions that are so important and something that I'm sure over the 100 plus, probably much more than that, physicians that you've mentored from undergrad all the way through, these are conversations you're having frequently. What is something that you wish students were more focused on? A character trait. Let's go with that.
I do think that it is important to be serious about the undertaking you are getting into. And again, not to be too serious, but I think when I was a third year, the enormity of what I had undertaken finally hit me. Because
Hmm.
first and
Hmm.
second year is kind of, well, it's college. I'm in a lecture hall. I take notes. I take tests, and it just felt like 2 more years of, more arduous college. And I did not come from a family of physicians. I'm the only physician in my family. And I remember in the middle of third year, that was kind of the first time that the enormity of the responsibility of caring for living humans hit me. Um, and that's a big moment
Hmm.
because, you know, when you're a kid, there's always somebody older, smarter, bigger, more wise. And then when you're an adult, like you're that person, like you're the one doing the procedure, writing the drug, making the decision. Um, and I think that I wish I had made that realization a little earlier. And we mentor, like in my current job, we have medical students, residents, and GI fellows with us all the time. Um, and so I don't work with too many undergrads now, but I think as an undergrad, if you're considering getting, an NP or a PA or an MD or a DO degree, like you do have to kind of recognize the seriousness and the enormity of what you are undertaking. And some people never figure that out, right? But I think that those who take it more seriously and have more ownership tend to do better. Nobody gets everything right every time, but like I just distinctly remember the moment when I was a third year when I had that realization that like, even as just a knucklehead third year, I was making decisions that affected patients' lives.
Hmm.
So I think that when you apply to these programs, right, PAN, PMDDO, like the people who can convey that have a maturity that will help them both during the application cycle and in school. And unfortunately, and I've interviewed for many medical schools over the years that I've been faculty on. A lot of people come off as very juvenile in their interviews. And like, I can't convey strongly enough what a deal ender that is, right? Like, it's not a lark, right? It's you're going into healthcare.
Hmm.
So again, I know we've kind of taken a serious turn, but I think it's really important. And I remember people who were like goofing around in the interview, and it was fun. We had a good time, but I scored them low. And the people who seemed awake, alert, committed, and understanding with the job they were asking to do, right, scored higher, even if they maybe weren't so charismatic, right? Like, who would you rather have take care of you?
Here on Shadow Me Next, we include a quality question, something that you can use to help you prepare for your own interviews. Today's quality question isn't something Dr. Adler said outright. It's a reflection of what he meant. He talked about how applicants show up, the tone they use, the way they carry themselves, even the little things like clothing choices or casual comments. And it made one point so clear. Your interview is the first moment you're asking someone to trust you with their patients and eventually with their own care. So here's your reflection for today. Would your interview presence make someone trust you with their care? Not your GPA, not your resume, your presence. So here's your action step. Record a 30 to 60 second answer to any common interview question. Watch it back only through the lens of trust. Would I trust this person to care for someone I love? Adjust one small thing, tone, posture, pace, or word choice, and then re-record. Keep in mind that there's more interview prep, such as mock interviews and personal statement review over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions. It goes back to professionalism, right? I mean,
Right.
your interview really is the start of your whole career. And that's what I tell our PA students. Are you looking at PA school and medical school as years 5, 6, 7, and 8 of college? Or are you looking at these years as years 1, 2, 3, 4 of your career,
Of your life,
of the
right?
rest of your life? And you're absolutely right. And you can definitely you can definitely understand the students who kind of feel that weight and feel that significance. When you were talking, it reminded me of our very first episode we ever recorded. I had a PA student on the show actually, and she mentioned how she was sitting with a patient and she had just told this patient they had pancreatic cancer. But she said, Ashley, it was so heavy because I knew pancreatic cancer. I had read about it in a book. I could describe the pathophysiology. I could describe all the treatments. I could describe, the expected outcomes, all the numbers. But looking at that patient and saying those words to that patient was just all of a sudden all that went away, and really the gravity of the situation was felt. So,
it's the worst news they're ever going to hear in their whole life.
Exactly. Exactly. And so much of the data and the studying doesn't really prepare you for that moment. So I'm really glad you mentioned that. Thank you for describing that, discussing that. Finding situations to really improve upon that is going to be the students' battle.
Yeah. Well, I think the interview, you have so little time in that interview. And, some interviewers are just looking for a reason to reject you. Right? Because everyone has good grades. Everyone was the smartest kid in third grade. Like they're looking for a reason, like, do they stand out in a positive or a negative way? And I've posted on X a couple of times about, you have to take the whole thing seriously. As my wife always says, everything is part of the interview. Um, dress conservatively. Like now is not a time to show your style or flair. Like weird clothing choices will be remembered negatively, like dress conservatively. And you don't know who your interviewer is. You don't know what their political alignment is. And, I've had people start making very, very political statements with me in interviews. And I'm like, why would you do that at all? Like, like no matter what I think or who I am, why would you do that? So like, I don't know, like you've got to play it very, very straight in the interview. But we used to sometimes like marvel what people would wear to their medical school interviews, and we would be like, wow, wow. I'm like, okay.
You
but,
do you. Oh,
right. I mean, you do you, but that's not what medical school is about. Like, I mean,
yes.
because really, to bring it back home, medical school is not about you.
Right.
It's about you saying, all these other people are more important than me, right? But if you
Yes.
come in, dressed like a peacock, like you didn't get that message, right? You didn't pick that up.
Oh, it's just we're laughing because it's inconceivable, but it happens.
It
I
does
mean
happen.
it really and not just I mean what they wear is an easy example. A lot of times it's what they say or what they do while they're sitting there chatting. You're right. We did take a very serious turn. It's absolutely
Right.
something that needed to be said and I'm really glad we talked about it. But let's end on a really light note and that
Sure,
is
sure.
that's something that you hinted at earlier when you were talking about your original major in college and it has turned in this incredible hobby that you have. Tell us a little bit about it and then if you would please explain why it is so important to do things outside of medicine.
So I am one of those people who wanted to be an astronaut. Um, to the point where, there was a time where I lived and worked at the Johnson Space Center and did research down there. Unfortunately, when I was thinking seriously about applying for astronaut candidacy, and everybody who knows me knows this, the Columbia disaster occurred, and then astronaut selection ended. So that there was like the kind of the period where I was like the perfect age and demographics. They closed it and it didn't open for years. But I've always been interested in aviation, astronomy, and aerospace. I learned to fly single engine aircraft a couple of years ago. And I became an aerospace writer. I do a lot of medical writing, but I found that it was very, very enjoyable to have outlets that were non-medical. I think now I've written about 90 magazine and web articles on aviation,
Oh,
aerospace, and astronomy. And it's given me the opportunity to travel around and meet some amazing people and interview some people that I had read about my whole life.
cool.
And then actually get them to sit down for an hour-long interview. Um, so that has been really, really rewarding. Maybe I'll get to fly on a Blue Origin rocket or a SpaceX rocket someday. I don't know. A little expensive right now, but I just a couple of years ago, I guess about a decade or so ago, I just started writing, and then I would just cold email editors in chief at aviation and aerospace magazines, and I would say, hey, can I write articles for you? And, sometimes you never got a response, and sometimes they told you to pound sand, and that was okay. But sometimes they would say yes, and then you would get something in on time and submit something of good quality, and that opened the door for the next article and the next article and the next article. So, in addition to, all the medical stuff, I'm always working on a couple of non-medical articles. And it's nice. Like, they come out in the Barnes and Noble. Like, medical articles don't come out in the Barnes and Noble. Like, write an article about going to the moon or going to the Mars or interstellar travel. You go to the Barnes and Noble and there's your magazine with your article in it. So it's kind of exciting.
That is very cool. It's incredible to have those hobbies just to tickle another side of your brain, a similar side. I mean, you're still writing, but something that you're very equally passionate about. And Dr. Adler, it has been such a pleasure getting to talk to you.
Thank you for having me.
It's been great. Definitely check out his podcast, Gastrointestinal Endoscopy. That's GIE, and follow him on X, previously Twitter, at Douglas Adler, MD. It's been so fun.
Thank you so much. I really appreciate it.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.